Welcome back, everyone. Hope you enjoyed watching the video. So what are your thoughts? What do you think actually happened next? Well, what happened was the patient actually didn't take the warfarin tablets. Why do you think that might have been? Do you think it was because he thought it was rat poison? Because he thought that's what killed his brother? Or was it because he is colorblind? Well, it was because he thought it killed his brother. That's why it's important to try and find out what the patient's thoughts are, what they're thinking. Remember, we don't have superpowers. We can't read people's minds, but we can do our best to gather the right information to help the patient make the choice. So if we think of the warfarin consultation in terms of the CBT model, what happens? Well, the patient, in terms of his emotions, he had a fear of taking the warfarin. In terms of his cognition, his thoughts, he thought it killed his brother. So what was his behavior? He didn't take it. What would be the physical implications of that? He's likely to get a blood clot. So remember, we're using the Calgary-Cambridge model, or sometimes it is called the Cambridge-Calgary model, for our consultation skills, learning how to do consultation skills in a stepwise manner. So we've looked at how to initiate a session. We've looked at techniques for gathering information. The next step is physical examination. Not every consultation will require an examination, obviously. I mean, depending on the setting, it might be something simple like looking at the rash, but here we're thinking about if you have to do tests. So before you do an examination or a test, think about it. Don't just do tests for the sake of it. Think about NHS resources. Only do an investigation when you have a reason to. Sometimes patients might insist, oh, they've got a real bad cough, chesty cough, they want an X-ray or they want an MRI scan, but you wouldn't just do it because they want it. It has to be justified. You need to know what you're expecting, what sort of results you would expect, and how to interpret those results. You need to know what to do if you don't get the result you expect, when to refer, who you would refer to. These are more the sort of things that you would do if you may be working in a GP practice or in a hospital setting. You might be working in a GP practice. You might do a simple dipstick test for UTI, urinary tract infection, kidney infection, diabetes or sexually transmitted diseases. You might be running an asthma clinic or reviewing an asthmatic patient, looking at their peak flow readings and asking them to do another one while they're with you. You might be doing a cardiovascular system examination, checking a patient's blood pressure. You'll learn a lot more about this in your cardiovascular lectures. When you're doing these tests, you need to think about things like what we call the I2C5. So for I2, that's the identity, 2 I's, identity, and informing the patient. So identifying the patient, making sure you've got the right patient. Identifying yourself as a practitioner, as the person that you're going to do this. You're going to be doing this test on the patient. Informing the patient is, again, just communicating with them, letting them know, checking, have they undergone this procedure before? Explaining to them what you're going to do, and why you're going to do it, what they might experience while you're doing the procedure. Remember to always use appropriate language that's appropriate to the understanding of that particular patient. You may need to ask them to remove a top or remove their cardigan or something. You should always explain and continue your explanation throughout your test or procedure, especially things like you might need to say, right, I'm going to touch you here if you were examining their belly or something, or let them know beforehand. That prevents any misunderstanding and possible litigation or accusation of inappropriate behavior. The 5 C's are consent, confidentiality, comfort, chaperone, concerns. So consent is obviously gaining permission from the patient. It could be verbal, could be implied consent. You might need to have written consent for certain examinations. Confidentiality, just reminding the patient that what they discuss or whatever the findings of the result are, they are confidential. They wouldn't be shared without the patient's permission, and they would be shared with other healthcare professionals involved in the patient's care. Comfort, you need to pay attention to the patient's comfort and their dignity throughout the test. Remember, respecting their concerns and their cultural norms. Chaperone, they might need a chaperone. If you're a male and it's a female patient, she may want another person present. You might want another person present for your own protection. So check if a chaperone is required. Would they like a chaperone? Concerns. Ask the patient, do they have any questions before you begin? Are they happy with what's about to happen or what you're about to do, whatever test you're about to do? So what's the next step after physical examination in our model? It's explanation and planning. Remember, physical examination's not always required, so it might be a step that's missed. That's why it's in red there. So once you've gathered the information, you might go straight to explaining to the patient and planning what to do next. In the explanation and planning stage, you need to be careful. Once you've identified the problem, be careful about giving premature information and advice and reassurance. You need to check, have you got all the information you need to help make the patient make an informed choice? Remember, we are using shared decision making. So we help the patient make an informed choice by giving them all the information to help them decide. So shared decision making is about involving the patient. So you involve the patient in by making suggestions rather than giving them directives. You can use the acronym ICE, ideas, concerns, expectations. So, you want to know, what are their ideas about this? What are their concerns and expectations from the treatment? You should use visual aids, leaflets, diagrams. Sometimes certain products come with patient decision aids to help them decide. You should always provide options, again, to help them decide. It may be that one particular preparation you have to use more often. Another one might be a particular one has an easier to use applicator, might be a bit more expensive, but it's easier to use. Always explain your rationale for what you're saying and discuss the potential risks and benefits of the treatment options. One might, the benefit of one might be that you only have to use it once a day. The other one might be that you have to use it 3 times a day, but it's more longer lasting. Always use clinical evidence, what we call evidence-based medication for treatments and outcomes. Always discuss side effects, unwanted side effects that are what other people may have experienced taking this medication. You need to be careful. You wouldn't want to go through the whole leaflet and read it out and completely frighten the patient. Focus on the common side effects. You may still need to touch on the rare side effects just so that they know what to do if they get a particular severe rare side effect, but do it in a balanced, appropriate way. This next slide looks at examples of shared decision-making websites that are provided by the NHS that you might want to look at or share with your patients. Remember, when you're doing a consultation, it's an ideal opportunity to help with the patient's self-care and give them lifestyle advice and signpost them. They might want to give up, and you may advise them on the right product is, or you may broach the subject and they may say, well, they are going to think about it, but not right now. You might want to refer them to a quit smoking service, a local quit smoking service, or ask them to come back when they're ready, and you can help them with that. Give them advice about diet, about 5 a day, the importance of getting 5 portions of fruit and veg a day. You might want to refer them to an alcohol advice service or the Change for Life website, which has a drinks checker on them if drinking can sometimes be a problem. Remember, this is a golden opportunity. We should always give healthcare and lifestyle advice at every opportunity that we can. You should always check that a patient understands the information that you've given them. Why do you think that's important? Remember, you shouldn't assume that a patient can read or understand. People have different levels of education, and we know for a fact that health literacy is a global problem. One definition of health literacy is the knowledge, motivation, and competencies of a consumer to access, understand, appraise, and apply health information to make an effective decision and take appropriate action for their healthcare. Now, that definition is from the Australian Commission on Safety and the Quality of Healthcare. So you should always give patients support to understand the information and take the appropriate action for their health. And be careful not to assume that just because you've given the information, that's it, that they've understood it. So, how do we check patients' understanding? Well, there's a few ways of doing it. Try not to ask closed yes/no questions like, do you understand? Do you have any questions? Try a different approach. You might say, now that we've discussed this, what do you think? Now that we've discussed this, do you have any further questions for me? What are your views? There are concepts like chunk and check, where you're going to give the patient information, teach them 2 to 3 main points with the first concept, and then check and they understood it, and then tell them the next few points and check. There's ask, share, ask. You might ask, can I provide this information? Okay, can you share what you've understood from that? Then you might ask, can I ask a personal question? There's another technique called teach-back technique. You could phrase something like, you could phrase your questions like you could say, right, I just want to double check that I've explained everything clearly to you. Do you mind repeating back what you've understood? You might want to do some CPD on some of these techniques, like the teach-back technique. So the final stage in our Calgary-Cambridge consultation model is closing the session. So this is coming to a final agreement with the patient regarding what are their next steps, agreeing an action plan. It's important that you summarize the session briefly and clarify what the plan is. And it's a way of doing a final check, again, to ensure that the patient agrees and is comfortable with the plan. Ask if there are any questions or corrections, any things they haven't understood, or anything they want to discuss further. So that would be the final step to closing your consultation session under the Calgary and Cambridge model. So to summarize, we have gone through all the stages of the Cambridge-Calgary consultation model. So we went through how to initiate the session, how to gather information, how to do physical tests, what physical tests that you may need to do as part of the process, what sort of explanations and planning to do next, and how to close the session. So that's the Cambridge-Calgary observational guide or model for doing a consultation. Before we finish this session or lecture, I want to just stress two important points that are more part of the neighbour model that we mentioned earlier, but I think are very important when you're doing consultations, and that's safety netting and housekeeping. So safety netting is very, very important, and it's something that you should still do as part of your consultation. It's about offering a contingency plan if things don't go to plan. So letting the patient know what to do if the problem doesn't clear up, say in an expected time frame, what to do if something unexpected happens, or what to do if they get one of the rare side effects. It's important because it protects you and the patient. It prevents unnecessary litigation if something went wrong. And you remind them, and you would finish by reminding them that they can ring you back if they have any further questions. So safety netting is a very, very important aspect of consultation skills. It's borrowed more from the neighbour model, but it's very important to do. So the other important aspect of consultation skills borrowed from the neighbour model, second one, was housekeeping. And that's about taking care of yourself and looking at the documentation required, not just the documentation required to do a good consultation, but actually documenting the consultation itself. You could record it in the patient's PMR. In hospitals, we record it in the patient's notes. Again, it's about protecting yourself so that there is a record that you did have that conversation with the patient. And like I said, it's about looking after yourself. So, ensure that you have a coffee break or relax. Don't go straight into the consultation and carry that tension over from a previous rude patient that you may have had. So relax yourself and make sure you're ready to go into that consultation completely refreshed. And please don't worry, doing a good consultation is a skill that you will pick up over time as you learn the techniques, as you do it in workshops, as you practice, as you observe your colleagues doing. But there is a wealth of information out there to help you further. The next few slides just go through some of the different packages available. Some are by the CPPE learning program, which you should have access to as students, and also some are available by the BPSA, the British Pharmaceutical Students Association. So this one's adapting your consultation skills when you're consulting with children and young adults. And here are some more examples of some of the CPPE packages available. So there's ones for consulting with older people, consulting with people living with dementia, consulting with people with mental health problems. and one that I would recommend that you download and keep and use, and it will come in handy for future reference as well, is the consultation skills for pharmacy practice. There are some links to the websites there for you as well. There's another one on depression, on consultation skills in depression, available by the BPSA website, I believe. Thank you so much for listening. Hopefully you enjoyed the session, and I hope it wasn't too much of an information overload, but we will practice these skills in workshops, and as you progress through your undergraduate course, you will learn more and you will get better at it. Trust me. Thank you again, and I look forward to meeting you all in the workshops. Thank you. Bye-bye.